separate mothers, separate mothers. You want me to talk? Hello everyone and welcome to semi-final 1 in the Ministry of Health and Wellness's Health Knowledge Quiz Competition. Of course, this is our second set of matches and we're so happy to have you joining us here on the Ministry of Health and Wellness's YouTube channel. My name is Javon Keys. Now the teams in this match are Team Seprod and Team Mothers. They have battled out all the rounds to make it to the semi-final action and we cannot wait to see how this will go. Of course, this is our 8th challenge in the Corporate Wellness 8x8 edition, brought to you by the team at Jamaica Moves, of course, as a part of the Ministry of Health and Wellness. And of course, this event would not be possible without our sponsors, National Housing Trust, IGL, Sagicor Life, Lifespan Water, and the NHF. So of course, before we get into section 1, let's meet the teams, starting with Team Seprod.
Hi, my name is Mona Lee Bailey.
Hi, my name is Katrina O'Sullivan.
Hi, my name is Courtney Ann Barks.
Hi, my name is Antonio Ross.
Thank you, Team Seprod. Now let's meet the team from Mothers.
Good afternoon, my name is Sanjay Enner.
Good afternoon, I'm Kenisa McPherson.
Good day, my name is Chriselle Crossgill.
Hello, I'm Amoy Harridge.
Thank you so very much, teams. Now let's get straight into the action. In section 1, teams will be asked questions alternately with 10 seconds to answer. Each correct answer is worth 1 point. With that said, we begin with Team Seprod. Your first question, what does the body use protein for?
To build and repair muscles.
We'll take it, growth and repair of the body cells. That's right. Mothers, in first aid, what is the RICE method used for?
Rest, ice, compress, elevate.
Not quite what we're looking for. It's injury treatment, but that's the meaning of RICE. So we'll take the meaning of it, no problem. I see my judges nodding, so you get that point. Team Seprod, what is tuberculosis?
It is a respiratory illness, a viral one, that is.
We won't take that. It's a bacterial disease affecting lungs or other organs. Team Mothers, what is breast cancer?
Breast cancer is the abnormal growth of cells or tissues in the breast.
We'll take it. A disease where abnormal breast cells grow out of control and form tumors. Team Seprod, what is the prostate?
It is an organ in the male body, or tissue rather, in the male body. Yeah, I'll leave it there.
Not quite. The prostate is a small gland that is part of the male reproductive system and helps make semen. It's now time for your question. Mothers, how long should you hold a static stretch?
2 minutes.
Incorrect. It's 15 to 30 seconds. Team Seprod, true or false, NCDs cannot be prevented.
False.
That's absolutely false. NCDs can be prevented by eating healthy, engaging in active living, and screening regularly. Of course, that's what's being promoted by the Ministry of Health and Wellness. Your question, Mothers, true or false, HIV can be prevented?
True.
That's correct. Prevention includes abstinence, condoms, faithful partners, STI treatment, and avoiding shared needles. Seprod, it's now time for your question. What are 2 common symptoms of a stroke?
Dizziness, slurred speech.
We'll take it. So headache, weakness, slurred speech. We'll take dizziness as well. Mothers, your question. What does rest day mean as it relates to exercise?
The day you get to recover your muscles and keep the body cool for the next exercise day.
And I see our fitness expert giving the thumbs up. That's correct. What is palliative care, Team Seprod?
It refers to the care that is given to patients who might be at end of term for a sickness or disease.
We'll take it. So it's support that relatives that relieves symptoms and improves the quality of life for people with serious illness, including cancer, even if the disease cannot be cured. Your question now, Mothers. When reading the nutrition facts panel, what should you look for to identify healthy foods?
So we look at the serving size, the daily vitamins, the percentage daily value, as well as the nutrients.
And calories.
We'll take it. So we look for foods that are low in saturated fats, trans fats, cholesterol, sodium, everything. But your answer is correct. Team Seprod, true or false, routine screening can save lives?
True.
That's right. What is the purpose of a cool down in exercise, Team Mothers?
So cool one is to get back your heart rate back to normal and keep your muscles well relaxed.
Absolutely correct. True or false, Team Separate? Smoking is associated with multiple NCDs.
True.
That's correct. Team Mothers. True or false, a negative HIV test taken less than 12 weeks after possible exposure does not always mean a person is HIV negative.
True.
That's correct. Team Separate. Where does prostate cancer start?
In the prostate or abdomen.
It starts in the prostate. That's correct. Mothers, what is considered functional strength?
So functional strength is exercises or strength that allows you to improve your daily life and function and day-to-day
We'll
activities.
take it strength used in everyday activities. What is colorectal cancer, Team Separate?
The colon.
And the rectum.
Correct. Colorectal cancer is a type of cancer that affects the colon, large intestines, and rectum. Team Mothers, wheat, milk, peanuts, and soy are examples of food that must be listed on labels if they are present.
Allergens.
That's right. Team Separate, what is an example of stroke rehabilitation activity?
Physiotherapy and,
Aerobic exercises.
right, aerobic exercises.
We'll take it. Physiotherapy, speech therapy, aerobic exercises, as you pointed out, we'll take that answer. Mothers, what does isotonic mean in exercise?
It's bringing back the equilibrium of the
Muscles and heart rate.
Not quite.
muscles.
So the answer we're looking for is muscle changes, when the muscle changes length under tension. That's really the answer we're looking for. And that's the end of the first section in this, our first semi-final match in our health knowledge quiz competition brought to you by the Ministry of Health and Wellness. We're going to take a quick break. When we come back, I'll give you the official scores at the end of section 1. And then, of course, we'll move straight into the exciting speed challenge. Don't go anywhere. ready whenever you are, okay? No, but you're not going, man. Tie? Watch out. Welcome back to our Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness. In this match, our first semi-final, the scores are separate on 9 and Mothers also on 9, so it's a tie. A nice segue into section 2, which is the speed challenge. Each team will get 60 seconds to answer as many questions as possible. Each correct answer is worth 1 point. With that said, we'll begin with Seprod. True or false, smoking increases risk of cervical cancer?
True.
That's right. Hypertension management can prevent complication?
True.
True, we'll take that. How long before or after PrEP? How long before or after taking PrEP does it provide protection for men?
7 days.
7 days is correct. List 3 risk factors for NCDs.
Poor diet, lack of exercise,
Poor diet.
and drug abuse
abuse.
or alcohol abuse or smoking.
That's correct. A transient ischemic attack, TIA, is another name for what?
A heart attack?
Incorrect, a mini stroke. True or false, family history affects your risk for NCDs?
True.
That's right. Reducing salt intake can help prevent what?
Hypertension.
Correct, or it can also help to prevent CKDs. True or false, moderate alcohol intake is safe for everyone?
True.
Incorrect is false. And that's where we end your 60 seconds. It's now time for your 60 seconds, Team Mothers. True or false, family support can improve adherence to NCD care?
True.
That's right. True or false, many cancers can be cured?
True.
Correct. Many cancers can be cured if detected early and treated effectively. Name 2 possible triggers for an asthma attack.
So allergens and air pollution.
Looking at my judges, we'll take it. True or false, sickle cell disease is a non-communicable disease?
True.
That's right. What is progressive resistance training?
It is increasing the amount of resistance or weight that you add
Progressively to each exercise or rep or round.
I got the thumbs up. That's correct. Ackee, pear, coconut oil are found in which food group?
Fats
Fats
and
and
oils.
oils.
That's correct. What does the acronym PEP stand for?
PEP is
Post
post-exposure
exposure
prophylaxis.
prophylaxis.
Correct. True or false, stress management is important for preventing NCDs, and we don't have time for that. The answer would have been true. That didn't come in time. It doesn't quite work that way. That's it for section 2, or speed challenge. Please stay with us when we come back. I'll have your updated results if there are any changes, and then when we come right back, we'll head straight into the Ding Dong Buzzer section. Don't go anywhere. Welcome back. This is semi-final 1 in our Health Knowledge Quiz competition, brought to you by the Ministry of Health and Wellness. Our scores are Team Seprod on 15 points and Team Mothers on 16, so just a 1-point difference. And it all comes down to this as we head straight into our buzzer section. In this section, teams will buzz in and wait to be identified before giving their answer. Each correct answer is worth 2 points, but if their answer is incorrect, incomplete, or if they fail to wait to be identified, then they'll lose 1 point. So it's risk or reward. With 5 minutes on the clock, we begin with our first question. True or false, regular checkups are unnecessary if you feel healthy? Team Seprod.
False.
That's correct. What is post-exposure prophylaxis? Team Mothers.
Post-exposure prophylaxis is medication that you'll take if you think you were exposed to HIV, and you must take it within 72 hours.
That's correct. What is one way to reduce the risk of cancer? Team Seprod.
Exercise.
And testing.
We'll take it. What is the ideal duration for a warm-up when exercising? Team Mothers.
So warm-up time is 20 minutes before exercise.
Not quite. The answer we're looking for is 5 to 10 minutes, and it's the duration for a warm-up is what we're looking for. So that answer is incorrect. Name 3 possible symptoms of asthma. Team Mothers.
Coughing, wheezing,
chest
Chest
pain,
tightening,
difficulty
breathlessness.
Correct. No, you have all the answers, it seems. How are treatments for prostate cancer chosen? Team Mothers.
Based on the level that you're at, you can either do surgery based on the stage of the cancer.
Based on the level is just enough. Don't worry, you secured your 2 points. That's correct. True or false, foods can be high in salt without tasting salty. Team Mothers.
True.
That's correct. Name the main additive agent in cigarettes. Team Seprod.
Nicotine.
Nicotine is correct. What do the DNA changes in cancer cells cause? Team Seprod. Correct. The changes tell the cells to grow and multiply quickly and not to die at a set time. So we'll take that answer. What's the best way to build muscle mass? Team Mothers.
So exercise regularly and
training,
increase
strength
your
training,
protein intake.
Yeah.
We'll take it. Progressive overload. What causes AIDS? Team mothers.
HIV virus or human immunodeficiency virus.
Well, we'll take it. So AIDS is caused by the human immunodeficiency virus HIV. Being left untreated or treatment failure occurs. But the judges are nodding, they'll take it. What does early diagnosis of cancer consist of? Team mothers.
Pre-screening.
Routine screening.
Routine screening.
Checkups.
And checkup.
Early treatment.
And regular medication is taken.
We'll take it. So we'll take that one. We'll take that. True or false? Obesity increases the risk of diabetes and hypertension. Team mothers.
True.
That's correct. What is the one way older adults benefit from doing regular strength activities? Team separate.
Increasing their strength.
Correct. We'll take it. True or false? Type 2 diabetes can be prevented with team mothers.
Regular treatment and screening. True.
Well, I mean, it's a true or false question, and you were giving us a response, so we can't take it, unfortunately. So you've lost a point. What is the primary cause of death from cancer? Team mothers.
Late detection as well as improper
Taking off
treatment and
medication.
not taking your medication as prescribed.
I see our judges saying, yeah, we can kind of take it. So cancer causes death mainly because of its cell growth uncontrollably, its cells growing uncontrollably, and it invades vital organs. What are some ways fruits and vegetables help our body? Team separate.
It gives us the necessary vitamins and minerals that we need.
I see a nod in the affirmative. You get those 2 points. That's correct. True or false? NCDs are not among the leading cause of team separate. Leading cause of premature death in Jamaica. False is indeed correct. How often should adults engage in muscle strengthening team separate?
Once daily.
Muscle strengthening activities. Incorrect. The answer we're looking for is 2 or more days per week. True or false? The armpits or underarms are examined during a breast examination. Team separate.
True.
True is correct. True or false? Cervical cancer cannot be cured. Team mothers.
False.
That's correct. Cervical cancer can be cured if it is diagnosed at the early stage. After taking pre-exposure prophylaxis, for how many days does a female have team mothers?
72 hours.
Have coverage? Incorrect. It's 21 days. What's the role of protein post-exercise? And the answer for that question would have been muscle repair and growth. We don't have time for any more questions. That is the end of our very first semi-final match in this health knowledge quiz competition, brought to you by the Ministry of Health and Wellness as a part of our Jamaica Moves campaign. We're going to take a quick break. When we come back, we're going to double check those scores. And when we return, I'll tell you which team will officially make it to the grand finale of our competition. Don't go anywhere. Welcome back. If you're just joining us, you missed an exciting match in the semi-final round of our Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness. Now the scores are Team Seprad on 30 points and Team Mothers just ahead on 33 points. What that means is that Team Mothers will advance to the grand finale, which will take place on April 30. And we cannot wait to see which team will join them in the grand finale and what that competition will look like. But nonetheless, we say congratulations to Team Seprad on a very well played match. And they will have to battle with the losers from the second place team in our next semi-final match to see which team will be crowned our third place champion. So you're not quite done yet, Seprad. You have one more match to play, nonetheless. But we say thank you to both our teams, and we ask the captains of both teams to come forward to shake hands in keeping with the true spirit of sportsmanship.
Well played.
Congratulations, and thank you so very much. So with that said, congratulations to both teams, and again, thanks to our sponsors, the National Housing Trust, NHT, IGL, Sagicor Life Jamaica. We also thank Lifespan Water and the National Health Fund, NHF. So, on behalf of the entire team from the Ministry of Health and Wellness, particularly the Jamaica Moves program, our judges, and of course, our technical team from the Creative Factory, I'm Javon Keys. Don't go very far because guess what? We have semi-final 2 coming up, so go and get your low sugar tea and you go get your water and your low sugar food and come back to join us so you can find out which team will make it to the grand finale next week. Stay tuned. Hello everyone and welcome to semi-final 2 in our health knowledge quiz competition brought to you by the Ministry of Health and Wellness. My name is Javon Keys and we're so excited to have our second semi-final match off and going, and this one is between Forestry Department and Team CB Group. Now of course, let's meet the team starting with the Forestry Department. Please introduce yourselves.
Hi, I'm Vivienne Martin.
Hi, my name is Shane Edwards.
Hi, Tanique Williams.
Hi, Andre Stevenson.
Thank you so very much, Team Forestry Department. Now let's meet the team from CB Group.
Hello everyone, I'm Heather Carter.
Hi, I'm Latoya Forbes.
Good afternoon, I'm Kiman Blackwood.
Hi everyone, I'm Janisha Campbell.
Thank you so very much, Team CB Group. Now let's get straight into the action. Teams will be asked questions alternately with 10 seconds to answer. Each correct answer is worth 1 point. So of course, with that said, let's get straight into the action. Team Forestry, true or false, snacking may keep you from becoming overly hungry or overeating.
False.
Incorrect, it's true. Team CB Group, which is a benefit of regular stretching? Or what is a benefit of regular stretching?
Improve flexibility.
We'll take it, or increased range of motion. How is TB treated, Team Forestry?
Antibiotics.
We'll take it. I see you're saying yes. A combination of drugs for at least 6 months, including antibiotics. Team CB Group, which of the following are you generally looking for less of on a nutrition label to indicate a healthier choice?
Sodium content.
Less sugar.
I'm looking at our judges. We'll take it. A dietary fiber, added sugars, vitamins. I see where that a little bit of an error there, but your answer is correct. What does FOBT stand for, and what does it detect?
Fecal occult blood test. It detects hidden blood in the stool.
Correct. Team CB Group, what are the 3 main types of cancer treatment?
Chemotherapy,
Radiation.
and
Cryogenic.
cryotherapy.
Not quite. So the answer we're looking for is surgery for removing the cancerous tissue, chemotherapy using chemicals to kill the cancer cells, and radiotherapy using radiation to destroy the cancer cells. So incorrect. Team Forestry, which muscle group is targeted by lunges?
Quads and glutes.
Correct. Team CB, true or false, patients with sickle cell disease could develop leg ulcers. Correct. Why are ARVs important, Team Forestry?
To suppress the viral load.
Correct. Team CB Group, one of the major risk factors for stroke is?
Smoking.
Looking at our judges, we'll take it. Hypertension is one of the major ones that we're looking for, though, but your answer is correct. Team Forestry, what does it mean when breast cancer metastasizes?
It spreads to other organs.
Correct. Team CB Group, how can cancer risk be reduced through vaccination?
It reduces the infection, it reduces the infection.
Vaccine have a preventative mechanism to reduce the
All right, so your time is up. Would you like to try Team Forestry? Go ahead.
Vaccines don't prevent cancer.
Vaccines don't prevent cancer is not quite the answer we're looking for. So what we're looking for is getting vaccinated against the HPV virus, for instance, and hepatitis B can in fact reduce cancer risk if you belong to a group for which vaccination is recommended. So it's really dependent. So Team Forestry, sit with you. What is the main goal for balance training?
All around the body function.
So time passed. Would you like to try Team CB?
To not stress your muscles.
Not quite. The answer we're looking for is to improve stability. Team CB still with you. True or false? Young children have small stomachs, so they need to eat small and frequent meals. That's correct. Team Forestry. Which activity best strengthens the heart?
Cardio.
Correct. Team CB, true or false? Must I keep taking meds if undetectable? That's particularly with HIV.
True.
True. Stopping allows HIV to return. Team Forestry, what is the window period? And that's in reference to HIV.
Time period between detection and symptoms, showing symptoms, or time between testing and showing symptoms.
Not quite. Is the time 6 weeks, 3 months before HIV antibodies are detectable in the blood after infection? And we have to balance out the questions asked. So Team CB, your question, if you want to know how much sugar has been added to a product, where would you look on the nutrition facts label? Added sugars is indeed correct. And that's the end of Section 1. We're going to take a quick break to double check those scores. When we come back, I'll have your results and we'll head straight into the speed challenge where teams will get 60 seconds each to answer as many questions as possible. Don't go anywhere. Welcome back to our Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness. This is semi-final 2 between the Forestry Department and CB Group. Now the scores are, after the first section of our match, Forestry on 6 points and CB Group, which got 1 answer in just in the nick of time before the break. They're just ahead by 1 point on 7. Which brings us now to our speed challenge. Teams will each get 60 seconds to answer as many questions as possible. Each correct answer is worth 1 point. With that said, let's speed right in with Team Forestry. Which fitness component does the Planck test?
Pass.
For strength. True or false? Can I transmit HIV while taking PrEP?
No. False.
So false is correct. PrEP is for HIV negative persons only. Drinking water during workouts helps prevent what?
Injury.
Not quite. Dehydration is the answer that we're looking for. Name at least 3 symptoms for advanced prostate cancer.
Pass.
You could say bone pain, accidental leaking of urine, feeling very tired. What is cardiovascular endurance also called?
Strength training.
Not quite. Aerobic endurance is what we're looking for. Which activity can help prevent osteoporosis?
Flexibility training.
Looking at our judge, not quite. So it's weight-bearing exercise. What is the difference between colectomy and... and colectomy is a surgical removal of a portion of colon. What happens when HIV enters the body?
It attacks the immune system.
Just in time, I see our judges nodding. We'll take that one. So the team gained 2 points in that segment. It's now time for your questions, Team CB. Which exercise is best for posture improvement?
Strength training.
We'll take it. Pilates is another one. What is a screening test for colorectal cancer?
Colonoscopy.
Colonoscopy, we'll take it. 2, fecal occult blood test is another one. Which type of exercise is best for weight loss?
Cardio. And strength training.
We'll take it. Aerobic exercise. How is a patient selected for a cancer screening program?
It depends on the age
group and
the state
type of cancer.
All right, so we'll take it. So we're looking at various risk factors, including age, sex, focusing on those most likely to benefit from early detection. What is the third most common cancer worldwide?
Cervical cancer.
No.
Incorrect. It's colorectal cancer. Dancing can be considered what type of activity?
Lateral.
Incorrect. It's aerobic. And that's the end of your 60 seconds, Team CB. At the end of section 2. Now, don't go anywhere. When we come back, we'll enter the Ding Dong Buzzer section, which will determine the winner of our match and the team that will make their way into the grand finale. Don't go anywhere. Welcome back. This is section 3 in our second semi-final match for a health knowledge quiz competition brought to you by the Ministry of Health and Wellness. The scores are Team Forestry Department on 8 points and Team CB Group on 11. It all now comes down to this. We're at the buzzer section. Teams will get the chance to buzz in, and once they wait to be identified and their answer is correct, they'll get 2 points. But if their answer is incorrect, incomplete, or if them no wait to be identified, then they're gonna lose 1 point. So it's always risk or reward when it comes to this section. Teams are ready on the pulse, fingers on the buzzers, as we head straight into this section, which lasts for 5 minutes. True or false, can I contract HIV from tattoo or piercing needles? Team Forestry.
True.
That's correct, if the equipment is not properly sterilized. Hypertension can lead to which kidney complication? Team Forestry.
Kidney failure.
We'll take it chronic kidney disease. What is one way to prevent HPV infection? Team Forestry.
To get vaccinated with the HPV vaccine.
Correct. We also have using condoms and voluntary male circumcision are always ways to prevent HPV infection. Which vitamin supports bone health with Team Forestry?
Vitamin D.
Support bone health with exercise. Vitamin D is correct. Fill in the blank. Check up, follow up, dash up. Check up, follow up, live up. What is the difference between a lumpectomy and a mastectomy? Team Forestry.
A lumpectomy removes a lump, and the mastectomy removes the entire breast.
Correct. What type of workout combines strength and cardio? Team CB. Well, I heard cardiovascular, which is incorrect. It's circuit training. That's the answer we're looking for. What type of beverages can you limit to reduce NCD risk? Team CB.
Sugary beverages.
Sugary beverages such as soda, sweetened drinks, etc. That's correct. What is the difference between early diagnosis and screening? Team CB.
Screening is used to detect if there's anything. Early detection is just a way of screening, or is
Not quite. Early diagnosis is being aware of symptoms and seeking medical advice for abnormal findings. Screening, however, aims to identify signs of a specific cancer before a person has developed symptoms. So incorrect, you've lost a point. Which activity enhances mental focus and calmness? Team CB.
Exercise.
Generally, yes. So we'll take it. We wanted you to be a little bit more specific, but I see your judges giving a thumbs up. Yoga is one of the specific measures. Fill in the blank. Early detection dash Team Forestry.
Saves.
Saves lives. That's correct. What is the relationship between obesity and prostate cancer? Team Forestry.
Increase the risk.
It increases the risk. That's correct. Which activity is best for strengthening the core? Team Forestry.
Abdominal.
Abdominal training like sit-ups.
Yeah.
We'll take it. Planks is another example. True or false, breast cancer can be found through screening? Team Forestry.
True.
Correct. Which sport includes all major fitness components? Team CB.
Track and field, sprinting, running.
Incorrect. Swimming. What does the WHO's Global Breast Cancer Initiative aim to do? So it aims to improve breast cancer control and reduce avoidable deaths by focusing on health promotion, timely diagnosis, and access to care. What happens to cancer cells that makes them dangerous? Team Forestry.
They grow uncontrollably.
Not quite. They can grow beyond their usual boundaries and spread to other organs. I'm looking at our judges. True or false, physical activity helps you to sleep better. Team CB.
True.
That's right. What should you do if you find an abnormal breast lump? Team CB. Seek medical attention indeed. What happens when cancer cells spread to nearby breast tissue? Team Forestry.
It metastasizes and affects other organs. Yeah.
We'll take it. When cancer cells spread to nearby breast tissue, it's called invasion, which creates tumors that can cause lumps and thickening. What is one example of moderate intensity activity? Team forestry.
Brisk walking or swimming.
That's correct. Name one measure to prevent diabetic foot complications. Team forestry.
Reduce sugar intake.
And that bell came before, but your answer is also not quite correct. It's any. So we could do daily foot inspection. Could ensure we're wearing proper footwear, keeping blood sugar under control, which is a key takeaway from our health knowledge quiz competition. So that's the end of our buzzer section and the end of the match. We're going to take a quick break. When we come back, I'll confirm for you which team will join us in the grand finale of our 2026 Health Knowledge Quiz competition, brought to you by the Ministry of Health and Wellness. We'll be right back. Welcome back to semi-final 2 of the Ministry of Health and Wellness's Health Knowledge Quiz Competition. And we're so happy to give you the final scores for our second semi-final match and to confirm for you which team will make it to the grand finale on April 30. So without further ado, Team Forestry, their correct scores, 29 points, and Team CB Group, they're on 19 points. So congratulations to both teams, and special congrats, Team Forestry. And just to let you know that Team CB Group actually gained 3 points. That's the 1 point they lost, plus the 2 points they should have gotten for their response to the question, which sport includes all major fitness components. Their response was track and field, and the judges have accepted their response. Therefore, their score was adjusted. With that said, Team Forestry will face Team Mothers in the grand finale on April 30. It also means that Team CB, your work not quite done yet, so now you still have to do some more studying because we have our third place playoff and Team CB Group will face Team Separate on the same day. So you at home will definitely want to ensure that you stick around and you join us on April 30. You're going to get your water, your low sugar food to join us to watch the exciting competition. And there's a lot more in store for that event, so you don't want to miss it. But of course, on behalf of the entire team, including our sponsors, the National Housing Trust, NHT, National Health Fund, NHF, Sagicor Life, Lifespan Water, and IGL, all our judges here on the ground, and of course the team from the Jamaica Moves program, and by and large the Ministry of Health and Wellness. And of course our team from the Creative Factory, our production crew, ensuring that we look good online. We thank you all so very much. So until next time, my name is Javon Keys. Take care.